Good morning, welcome to my channel Rad Academics. Today we are going to discuss on the topic Basic Principle of Radiography. Positioning Terminology. So this is the anatomic position of our human body. Standing erect with the face and the eyes directed forward, arms extended by the side with the palm facing forward anteriorly, heels together and toes pointed forward, or anatomic terms refers to the anatomic position. So, the anatomic position is standing erect with the face and eyes directed forward, arms extended by the side with the palms forward anteriorly, heels together and toes pointed forward. All positioning terms refers to the anatomic position. Again, we are moving on to the body planes. How our human body is divided. It can be divided by a sagittal plane, mid-sagittal or median plane, coronal, frontal or mid-coronal plane, oblique plane, and the horizontal plane, axial. So what is meant by body planes? Body planes are the imaginary lines passing through the body in the anatomic position. As the body planes are of three types, first one is the mid-sagittal plane. Median plane is a longitudinal plane which divides the body into equal right and left portion, abbreviated as MSP. A sagittal plane divides the body into right and left section but not equally. These planes run parallel with the mid-sagittal plane. Mid-coronal plane is a longitudinal plane which divides the body into equal front, anterior and back posterior sections, abbreviated as MCP. Coronal plane divides the body into front and back sections but not equally. These planes run parallel with the mid-coronal plane. And the last plane is a transverse plane which divides the body into upper, superior and lower inferior sections. So these are the three planes. Mid-sagittal plane which divides the body into equal right and left portion. Mid-coronal plane which divides the body into equal front, anterior and back posterior section. And the transverse plane which divides the body into upper superior and lower inferior sections. So with that you understood the three planes of our human body. Again we are moving on to the body surfaces. Anterior ventral, that's seen when viewing the patient from the front. Posterior or dorsal, that's seen when viewing from the back. Here are the two images of showing the body surfaces. This is the anterior surfaces when viewed from the front, and this is the posterior surfaces when viewed from the back. Again, surfaces of the feet and the hands. The posterior sole of feet is known as the plantar aspect. The top of the foot or the anterior or the dorsum pedis is known as dorsum. And the palm of the hand, that is known as the anterior or ventral surfaces, is known as the palmar aspect or palmar surface. Again we are moving on to the general body positions. First one is the supine. When the patient is lying on the back face up, then it is known as a supine position. When the patient is lying with the face down, it is known as prone position. When the patient is lying down in any position, it is known as recubdant position. And when the patient is supine with the head lower than the feet, is known as Trellenberg position, and the patient supine with the head higher than the feet is known as Fowler's position. And when the patient is in upright position, I mean when the patient is standing, then it is known as erect position. When the patient is lying with the face up is known as supine position. When the patient is lying with the face down is known as prone position. When the patient is in any position is known as recumbent. Since the patient is turned to the right side, it is known as right lateral recumbent. Since the patient is turned to the left side, it is known as left lateral recumbent. And Fowler's position means the patient is supine but the head is higher than that of the feet. Whereas in Trellenberg position, the feet is higher than the head. But the patient is in supine itself. Then we are moving on to specific body position. Always described by the side or the sides closest to the image receptor. Erect or recumbent lateral position. Again we are moving on to a lateral position. Right lateral, then the right side of the patient will be closer to the image receptor, and in the case of a left lateral, the left side will be closer to the image receptor. So will you able to describe this patient position? This is the image receptor, and from this image you can see that this is the patient's right side, this is the patient's left side, and CR means the central ray. So the ray is coming from here. Okay. So which aspect, patient's which side is in contact with the image receptor? It is right side. So if your answer is right lateral erect position, then you are correct, since the patient's right side is in contact with the image receptor. So will you able to describe this patient position? So the patient is in recumbent, that the patient is lying on some side, any side patient can lie. And here the which side of the patient is in contact with the image receptor? Patient's right side is in contact with the image receptor. So if your answer is right lateral recumbent position, then you are correct. Again we are moving to the oblique position. The chest, abdomen or pelvis is rotated from the supine, prone or lateral position. The limb is rotated from the anteroposterior AP, posterior-anterior PA or lateral position. So we have already studied or discussed how the patient is supine, how the patient is prone, or how the patient is in lateral. Okay. When we are rotating from such positions, it will be called as oblique positions. So, specific oblique body positions. Anterior oblique, as lateral are described by the body surfaces closest to the image receptor. In the case of lateral, when we have discussed right lateral and left lateral, it was clear that the which side is in contact with the image receptor. That side will be termed as the projection's name. Right lateral means the right side is in contact with the image receptor. Left lateral means the left side is in contact with the image receptor. When we are moving on to the oblique positions, RAO, it will be abbreviated as RAO, and it is right anterior oblique position. In the case of a right anterior oblique position, the right anterior surface will be closest to the image receptor. In the case of left anterior oblique position, the left anterior surface will be closest to the image receptor. So it is clear, and we have got a clue from this that When we are saying one projection, that right anterior oblique, you should be clear that the patient's right anterior surface is in contact with the image receptor. So, will you please identify in which position is this patient positioned? So, this is the image receptor, and when we are viewing from the patient from the back, then it is known as the posterior aspect. So, which aspect is in contact with the image receptor? Is the patient's right side or left side, and the ray is entering through the posterior aspect? So the patient is in oblique position. So which oblique position is this one? If your answer is erect right anterior oblique position, then you are correct. Then identify which position is this patient. Patient's anterior aspect is patient is in recumbent position, and patient's anterior aspect is in contact with the image receptor. So, if your answer is recumbent right anterior oblique, you are correct. In the first projection or in the first image, we have seen the patient is standing and anterior aspect is in contact. While in the second image, we have seen the patient is in recumbent position and the patient's anterior aspect is contact with the image receptor. Again, we are moving on to the specific oblique body positions. Posterior oblique. As lateral and anterior oblique position are described by the surface closest to the image receptor, right posterior oblique position means right and posterior surfaces is closest to the image receptor. Left posterior oblique means left posterior oblique position is closest to the image receptor. The same thing we have discussed above. When the patient's anterior aspect is in contact with the image receptor, we call this as right anterior oblique, and when the patient's posterior aspect, right posterior aspect is contact with the image receptor, then it is known as right posterior oblique. Likewise, when the left posterior aspect is in contact with the image receptor, it is known as left posterior oblique position. In what position is the patient positioned? Will you be able to identify this is the image receptor and the patient's one side is in contact with the image receptor and the patient's posterior aspect is in contact with the image receptor and the central ray is entering through the anterior aspect. So if your answer is erect left posterior oblique, then you are correct. Means the patient is standing, that determines the erect. Then the patient's left side is in contact, so left. Then the patient's posterior means back aspect is in contact with the image receptor. Then it is an oblique view. The patient have rotated, so the position termed as erect left posterior oblique. If this is the answer, then you are correct. In what oblique position is this patient? So the patient is recumbent and one side is in contact with the image receptor and the patient's posterior aspect is in contact with the image receptor. So if your answer is recumbent left posterior oblique, then you are correct. Since the patient is recumbent, patient's left side is in contact, patient's posterior aspect is in contact and the patient is rotated, oblique. So recumbent left posterior oblique, then you are correct. So An image taken in the right anterior oblique position will correspond with the image taken in the left posterior oblique position, and an image taken in the left anterior oblique position will correspond with the image taken in the right posterior oblique position. Hope you all have understood. Again we are moving on to the oblique projections of the extremities. Medial or internal rotation, the limb is turned in towards the median plane or midline of the patient. Lateral or external rotation, the limb is turned away from the median plane or midline of the patient. So this is the lateral rotation. When the patient hand is rotated, extremities determines the hand and the foot. When the hand is rotated outwards externally, then it is known as lateral rotation. When the patient's hand is internally rotated, then it is known as medial rotation. Again moving on to specific decubitus positions, LLD. Left lateral decubitus position, the patient lying on their left side with the image receptor placed vertically and the X-ray beam is horizontal. Right left LD means right lateral decubitus position, the patient lying on the right side with the image receptor placed vertically and the X-ray beam is horizontal. So these are the images of some decubitus positions: ventral decubitus, dorsal decubitus and left lateral decubitus. Ventral decubitus means the patient is prone and a horizontal beam is used. So this is the image receptor. Okay, and we are exposing the patient using a horizontal beam. This is the dorsal decubitus. The patient is supine and horizontal beam is used, and this is the image receptor. And this is the left lateral decubitus. The patient is lying on the left lateral side. When the patient is turned to either side, then it is known as lateral position. And if the patient is turned to the left side, patient's left side, then it is known as left lateral. And when the patient is turned to the right side, then it is known as right lateral. And here we are using a horizontal beam for exposing the patient, and it is known as left lateral decubitus. Specific decubitus position, dorsal decubitus position, the patient lying on back with the image receptor placed vertically adjacent to a side of the patient and the X-ray beam is horizontal. Ventral decubitus position, the patient lying face down with the image receptor placed vertically adjacent to the side of the patient and the X-ray beam is horizontal. Both the dorsal and ventral decubitus position always demonstrate a side or lateral image. Radiographic projections. Projections are different from position in that they describe the path of the central beam CR or X-ray beam as it passes through the patient. The term projection always refers to the path of the central ray as it exits the X-ray tube, transfers the patient and reaches the image receptor regardless of the body position. So anteroposterior, again we are moving on to some projections, radiographic projections, anteroposterior. So briefly if we say that anteroposterior, from the A determines that the ray is entering through the anterior aspect. The first A determines the ray is entering through the anterior aspect, and P, the image receptor, is placed in the posterior aspect. It is a simple hint to remember what is meant by anteroposterior. The central ray enters the anterior body surface and exits the posterior body surface. The image receptor is closer to the posterior aspect of the patient, produces a posterior view. A view is the opposite of a projection. When viewing a radiograph, the term view represents a position. For example, if the patient is radiographed in the lateral position, then the image is said to be a lateral view. This is an image of an anteroposterior projection. Here we can see the X-ray tube, image receptor and the patient position. As I said before, anteroposterior. From the A, it determines that the ray is entering through the anterior aspect, and P determines the posterior aspect, and here we can see the image receptor is on the patient's posterior aspect. So, it is a hint to remember that when the ray is entering through the anterior aspect, then the projection is termed as anteroposterior. Posterior projections, PA projection. The central ray enters the posterior surface of the body and exits the anterior surface. Image receptor is closest to the anterior surface of the patient. So, from this, as I said before, when the ray is entering through the posterior surface, then the projection is termed as posterior projection. Then the image receptor will be placed at the anterior aspect. This is the image showing a PA projections. It is clear from that we can see the X-ray tube and the ray is coming and falling on the patient's posterior aspect, and the image receptor is on the patient's anterior aspect. So simply we call this projection as posterior projection. Again, moving on to the oblique body projections. Includes the thorax, chest, abdomen and pelvis. Right anterior oblique and left anterior oblique projections are posterior oblique projections because the central ray will enter the posterior surface of the patient and exits the anterior surface. Then oblique projections are described in some sort of other way. Okay, that means in here, before we have discussed as simply we say that right anterior oblique or left anterior oblique. We can either say from that term that the anterior aspect of the patient is in contact with the image receptor and the ray is entering through the patient's posterior aspect. Okay. In the case of right posterior oblique or left posterior oblique positions or anterior oblique projections, since the ray are entering through the anterior aspect. It is defined in some other way. We can determine or we can understand or we can study in a way that when we are speaking about anterior oblique position or left anterior or right anterior, just keep in mind that the patient's anterior aspect is in contact with the image receptor and the ray will be entering through the posterior aspect, and the other case vice versa. Projections of the feet. Feet are commonly imaged so that the central ray enters the top or the superior surface of the foot. So the anterior aspect of the foot is known as dorsum and exits the bottom or the inferior surface of the foot plantar. So the projection is referred to as the dorsoplantar projection. So when in the case of a foot, when the ray is falling on the topmost portion, it is known as the dorsum aspect, and the below portion is known as the plantar aspect. Again, we are moving on to the axial projections. Longitudinal angulation of the central X-ray tube towards the head is known as cephalad, or to the feet is known as corded angulation. This is an image showing the cephalad and caudal shear angulations. This means in the above slides we have studied the position of a patient, how the patient is supine or prone, how he recumbent, then the patient is erect, lateral, decubitus. Many rotation, even oblique we have studied. So in some cases the patient won't be able to rotate. In such cases we will be rotating the X-ray tube. Okay, so if we are rotating the X-ray tube towards the feet, then it is known as corded angulation, and towards the head it is known as cephalad angulation. Again, moving on to the tangential projections, the X-ray tube is directed towards the outer margin of the curved body surface to profile a bony part just under the surface or a surface lesion and project it free of superimposition. This is an image showing the tangential projection of the cheek bone or zygoma. This is the tangential projection of the kneecap or patella. Relationship terms. Medial, inside part closest to the median plane or midline of the body. Lateral, away from the midplane or midline of body. Proximal, near the source or beginning. In regard to extremity, the part closest to the trunk of the body. Distal, away from the source. In regard to extremities, the part further from the trunk of the body. Here are some relationship terms. Here you can see the median plane, proximal, distal part, medial arm, lateral arm. I mean the lateral aspect of the hand can be seen, medial aspect of the hand can be seen, median plane can be seen, proximal and the distal part can be seen. Kindly go through this image. Relationship terms. Cephalad means towards the head. Corded means towards the feet. Superior means nearer the head or situated above. Inferior nearer the feet or situated below. Ipsilateral part or parts on the same side of the body. Contralateral part or parts on the opposite side of the body. Body movement terminology. Abduction. Lateral movement of arm or leg away from the body. Adduction. Movement of arm or leg away towards the body. Flexion. Bending or decreasing the angle of the joint. Extension. Straightening or increasing the angle of the joint. Body movement terminology. Eversion. Outward turning of the foot at the angle. Inversion. Inward turning of the foot at the angle. Pronation. Turning of the palm of the hand down. Supination. Turning the palm of the hand up. Here are some of the body movements, extremities. Hope you all are clear with the class, with the anatomic position, body planes, body surfaces, body rotation and surfaces of the extremities, projections, movement, and if the patient cannot move or if the patient cannot rotate, then how can we take images? How we, in which all cases we are using a horizontal beam. Hope you all understood the class. Hope you all enjoyed the session. Stay tuned for the next topic. If you have liked this video, please don't forget to like and to subscribe my channel. Thank you so much.